I've been a lived experience investigator on a research project testing whether a successful community-based program for older people living with dementia could be translated into aged care homes. The program is called the Care of People with Dementia in Their Environments, or COPE. So COPE is an evidence-based occupational therapist-led intervention which supports people living with dementia and their carers or family members to live independently and to maintain relationships with the people, places and interests in their life. I was aware of COPE in the community setting when I was working in aged care roles. And I'd also had contact with the researchers who were involved in that work. One of them in particular is Mia Raja. When Mia started the project looking at COPE in residential aged care, she learnt that I was also interested in being involved as a consumer in health research roles. So she approached me to see if I'd be interested in this particular project. My role with the project has included providing a lived experience perspective, that's lived experience from my perspective as a carer, on the direction of the research, including data collection tools that could be used, recruitment of research participants, reviewing the findings, reviewing articles that have been written and other written information that went out. And most excitingly, I was asked to present the research findings at a conference in 2024, which was about aging research. What we experienced, both the researcher and myself, was I brought a different perspective to the research because of my first-hand experience with the challenges and needs of supporting and maintaining a relationship with someone in residential care. Through all of this process, I reflected on my father's experience and how I would have loved to have had a program like COPE available to him. So the opportunity to see if it would work in practice and that could have made a difference for Dad was really important for me. This perspective also allowed me to help shape the research questions and the objectives to ensure that they were relevant to both the people living with dementia and to carers, and so that what the project was about would actually make sense to carers. In particular, I was able to provide a more comprehensive view of the care ecosystem, highlighting the interconnectedness and disconnection of various aspects of care, from the medical through to emotional support. In practical terms, in the conduct of the project, while I was able to co-facilitate focus groups with carers, so both Mia and I were the facilitators, we noticed that there was a greater sense of trust from the participants when I was there. For example, when we first introduced ourselves, they visibly relaxed when I said, "I've been where you are now." It seemed to break down a barrier. While I could sense it a bit, Mia said that she could see the change and it was quite obvious. As a result, we feel that the carers who are involved engaged more with our study, were more open, and they also said that they knew that this research was valued and that we had respected their experiences.